Welcome to the Hairmedic podcast. These short clips are designed to help you understand your hair loss and scalp problems better. If you have any further questions or wish to get in touch, or if you want more information, log on to hairmedic.co.uk or call 0845 644 9384. This podcast is about understanding your hair problem a little bit better and when to know when you actually have a problem. So once you realise you have a hair problem, what are the possible causes? There are many different types of hair loss problems, and for that reason it's really important that you get a proper diagnosis. But we'll go through some of the main reasons first. So the main reasons for hair loss are divided up into genetics, which is the most common cause of hair loss in men, about 90%. Genetics in women is a little bit more of a difficult subject because after the menopause, women's hair does tend to thin genetically, and it does play a part of about 50% of cases. But it's not just purely genetics. There are other things that can exacerbate that. So again, these aren't clear-cut problems. Diseases, many underlying problems can cause hair loss disorders. They do not attack the hair itself. It's usually to do with the hair cycle, which it changes. It speeds it up or slows it down, and causes the hair to not grow for as long. And this causes excessive thinning of hair, excessive shedding of hair, or over long periods of time, just chronic thinning. Autoimmune disorders. This is where the dreaded alopecia we all know fall into. Alopecia itself is a word that just means hair loss. But when people usually talk about alopecia, they are talking about the patchy hair loss, the full head hair loss, the full body hair loss. And that's to do with the body attacking the hair follicles itself. Nothing to do with a disease that you've contracted. It is literally just the undefended system tripping out and causing problems. Mechanical forces, this is bleaching, perming the hair, using straightening irons excessively, different types of hairstyles, basically abusing the hair to the point where it's breaking off rather than it falling out from the root. All that type of thing can contribute to thinning hair. Medication. There's lots of medication that can affect the hair. Some in a good way, some in a bad. And obviously, at consultations with either myself or the GP, we would go through a case history and make sure that you're on the best types of medication that you possibly can be on. And it's always worth talking to the GP about the medication if you're worried about it. Lifestyle. Now that's a bit vague, but certain types of stress, I won't say daily stress, but severe amounts of stress, lifestyle choices, that includes things like restrictive diets, diets which exclude different types of food types like veganism or vegetarianism. Those can have a negative impact on hair. And they all have a part to play, and one of those things can exacerbate another. So if you have an illness, that can exacerbate a genetic disorder. So it's a very complex situation which you do need to have a proper diagnosis about. There's many other different types of things: hormonal disorders, vitamin and mineral deficiencies, acute febrile illnesses, things that you get a fever from. Too numerous to mention, so it's really important that you would try and diagnose properly what the underlying problem is, because obviously it's a very complex picture that I'm painting at the moment, and you need to hone down and you need to figure out what the problem is. And usually if we do that, get the correct diagnosis, most of the hair problems that I've spoken about can be treatable, with a great many reversible. We just need to know what we're dealing with.